A lot of people have questions they want to ask the doctors, and our staff is not immune to health woes. Carly is one of our researchers. She's backstage with a jaw-dropping question. Hey, Carly, what's going on?
Hey, so on the job, I'm always talking to guests, and I'm always on the phone, but my jaw always clicks like that. It makes a disgusting sound. It sounds and it feels like little bones are crushing, and I'm really starting to get worried that I'm causing permanent damage. I'm wondering, is there anything I can do to stop the popping?
Good question.
Yeah, that's a great question. I get that quite often. A lot of patients come in and they have clicking jaws, and it can be actually something that's very innocuous, and it could be something that could be a little bit more serious. Most of the time, it's very innocuous. There's a basic number of causes. It could be something from a trauma, from an accident, getting hit in the face. It could be actually osteoarthritis in the joints. It could be from a bad bite where your teeth and your jaws are in conflict and they don't fit together, so you're constantly fighting that movement. And in the joint itself, you have a little demonstration.
So Dr. Murphy, you're talking about our temporal-mandibular joint,
That's right.
Our so-called jaw joint, which is so overlooked. We talk about elbow joints and knee joints and hip joints.
Right.
Very important joint. I mean, we're using it all the time when we talk, when we eat.
Talk, eating, swallowing, all those things. It has to brace itself inside the skull, and there's a little disc that fits in between the little ball and socket on each side of the jaw joint, and the muscles can be in conflict. You can have a bad bite between where the teeth fit and where the jaws fit. So the important thing especially for Carly and anybody, is to diagnose what the cause is or what the problem is. She came into the office and very concerned about what's going to happen to my jaw joints, my temporomandibular joints. And fortunately for her, it was very minor, but the proper thing was to do a thorough diagnosis. But to do the diagnosis, you have to do a thorough exam, you listen to the joint with a stethoscope, and we actually also take a three-dimensional cone beam CT scan, which you can see Carly is sitting there very still, and we take a nice image. We get a three-dimensional image of the joints, and if you can read the radiology and look at these joints, she has an absolutely normal joint on both sides of her jaw. So what is actually happening is she has a really hypermobile, anatomically she's developed a really wide open, so she can move that jaw joint and move the ball and socket out of position.
Is that almost like popping your knuckles where it's
Exactly,
benign?
yeah.
Is the red flag when you're having pain, is that the biggest red flag, or are there other red flags to look out for?
Well, the crunching is not a good sound. There's things called crepitus. There's different types of terminology for it. You just have to diagnose it, look at the joint. Is there actually derangement or damage to the joint, or is it basically muscle pain? Sometimes it's just the muscles themselves are in spasm. And if you clench your teeth, you're going to get more pain, usually in the muscles. Some of the cures, and especially for Carly, is after we diagnose it and she has a normal joint, is to really just relax the muscles. How do you relax the muscles? Stretching, opening your mouth wide, moving it left and right, trying not to intake too much caffeine before you go to sleep and eat too much. That tends to make us clench and brux our teeth. Wearing a night guard, which is a appliance that fits something like this on the upper teeth usually, and by doing that, you put the interface in between the teeth, you kind of position the jaw correctly, and in doing so, the jaw somewhat relaxes. You protect the teeth.
Sometimes people have even come and had botulinum toxin to relax the muscle as well, especially if they're clenching and getting an overactivity of the muscle that's causing pain.
Exactly right, because sometimes just wearing a night guard itself is not enough to break the cycle of spasm in the muscle, so Botox is often injected. I've had it done in my jaws, my masseter muscles here, and it does relax the muscles.
That's why the masseter muscle.
Masseter muscle is this one right here. You feel right, the hard part of your cheek right here. When you clench your teeth together, you could probably feel it in your own jaw. And you feel it muscle when you squeeze your teeth together. We put a little botulinum toxin in a couple locations in this muscle. You can still chew, you can still smile, you can still eat, talk. It just relaxes that spasm just as if it was anywhere else in your body.
As far as mouth guards go, I know that a lot of people just go buy them off the shelf. Do you want to see a true specialist when it comes to TMJ if you've got pain developing in that area to get the right diagnosis and maybe mouth guard for you?
Absolutely, because where you position the jaw and how your teeth come together, and actually starting with the proper diagnosis, will determine whether you need something more extensive or something very minimalistic. In Carly's situation, it's really just a hypermobile joint. She's developed with a wide opening and some clenching. That's all her problem is. So to get the over-the-counter ones is not going to position the jaw correctly, and there's no diagnosis.
And you could end up worsening the problem, so be careful of that. Carly, I want to see your most relaxed jaw look right now.
Oh,
nice. Well done, Carly.
Pose right there.
Thanks, Dr. Rifkin. Really appreciate it.